All right. So, as you may know, in acupuncture research, the placebo effect is a really both intriguing and challenging methodological issue. And the expectancy has been one of the factors identified to play a key role in the so-called placebo effect in years of psychological research. So there's some shared commonality between acupuncture research and behavioral psychology research. So that's why that's one of the variables I choose to start focusing first. And like trying to understand any kind of process, whether it's cognition or physiological process, having a valid measure is always the first step. Because without that kind of measurement, you cannot quantify nor you can study it. So that led me to develop and then validate the instrument to measure expectancy. I think when you think about researching the placebo effect of acupuncture, you need to look at what is actually delivered as part of the placebo acupuncture, right? Sham acupuncture. So there's the process of patient being engaged in the treatment. So engagement, I think that's a really important another factor, and relaxation as part of intentionally lying down for 20-30 minutes once or twice a week. And also I think what is interesting about acupuncture and some of Professor Che's study, with acupuncture there's this perception needle penetrating the skin. So there's potentially like a violation of the boundary of the skin. So that potentially can create a heightened you can call it stress response or heightened sense of vulnerability. And that may also let patient to be more willing to be suggest to placebo, to be suggesting, right? So and also other factors like hope, trust, alliances with the acupuncturists. I think it's definitely probably going to be a multi-component sort of effect. I think trying to understand each individual component, ultimately I think the goal is not try to just understand, also as practitioner, how do we operationalize our therapies to enhance therapeutic outcome. I think that's where our goal is. Well, I think I could think of many advantages of acupuncture. There has been, certainly we need more research, but there's definitely enough promising signals to suggest acupuncture can be very helpful for managing pain in cancer patients, helping nausea, vomiting, cancer-related fatigue, potentially with sleep issues, and psychological distress. And often a cancer patient don't experience just one of those symptoms at one time. So if you have to use drugs to manage, you will need multiple drugs. And so with acupuncture, it's a much more holistic treatment to really help that individual to. Also, in my experience working with cancer patients they go into treatment to survivorship or end of life, often they have this sort of acute heightened sense of uncertainty or stress associated with getting a diagnostic test or there's progression of their illness. So acupuncture can really help to provide a sense of control and a sense of peace and calmness in a very sort of chaotic terrain of the cancer treatment and survivorship. In terms of, I think the challenges of acupuncture, I don't know about in Korea, but in many countries acupuncturists are not covered in insurance system. So cancer patients often have to pay a lot of money for their cancer treatment. So that added cost is definitely a challenge. And also, I think how to figure out how to best integrate acupuncture into conventional care is a challenge. So often cancer patients go to see multiple doctors. There are surgeon, chemotherapists, radiation therapists, among many other doctors. So spend additional time adding another layer of complexity in their treatment can be stressful. So I think there's definitely a lot of work in healthcare innovation and policy to figure out how do we integrate acupuncture as part of comprehensive integrated approach to help cancer patients with their sense of well-being, adequate symptom control, and potentially to improve their clinical outcomes.
Okay, thank you very much.